all kinds of and all kinds of EKGs, brain scans, different things. They couldn't find anything.
Dr. Eric's be in in just a minute or two, guys.
EKGs showed that he was having seizures. Put him on medication, and he continued to have seizures, and every time I called the neurologist to tell him he's having seizures, they said, well, let's put him on more medication. And in the same sentence, they tell me this will hurt his liver over time. And, really were no help at all. Basically sent us away with the medication and said, see you in a year. Well, that wasn't good enough for me. And just kept trying to do different things, trying to go to different specialists, not getting the answers we needed, and finally a good friend of my husband's recommended that we come to Dr. Eric. And I think as a parent, you're skeptical, but you get to a point where you say, I'll do anything, whatever I have to do to make my child feel better. And so we did, thank God. I feel totally good. That was my blessing, and the prayers and the answers to my prayers. I started having seizures, and he just couldn't figure out what was wrong with me, and we finally came here, and it's really helped. By the first adjustment, I actually started feeling better.
How you doing, man?
Good.
How'd you drive for your adjustment last time?
Good.
Pretty good.
Started out chiropractic, just a blessing to be here and be able to help me. Just all the help you've given me and my family. It's a blessing.
We were recommended by a soccer coach, a friend of ours, and so I wanted to get off of my MS medication because I haven't had many MS attacks since the original diagnosis. So they're telling me that they can't tell me for sure if I have an MS attack, and so I have another one, and I haven't had another one. And because of that, large, I gave up soda the day I found out I had MS. I gave up soda. I gave up soda, it's probably been 2 years, and I really missed it on occasion, but not enough to drink for. It means living to the best of my ability. It means living to the best of my capability. I feel like it adds life. I mean, I don't know how else to put it. I can do more, feel more. My goal is to have my body functioning on its own correctly, and my goal is to thrive on itself.
The only thing that we tried before in chiropractor was, we buy those big old jars of Tylenol. Not the little ones, the jumbo size ones. And I even tried drinking alcohol.
Hey guys, he is on his way in. Have fun, learn lots.
Hey guys, how we doing?
Good.
Good. So I'm going to be going through some x-rays out here, but I won't be going through you guys' stuff, so you can relax. I won't put your stuff up here in front of anybody. We'll take you back individually and go through your x-rays with you in private in a few minutes. What I'm going to do here is make sure you understand what you're looking at when you see your x-rays, because the more you understand about the problem you have, the faster you get better. And that's what we want for you, is to get well as quickly as possible. You may have financial questions, insurance questions, so we'll go through this with you in private as well in a few minutes. Just a little bit about me, for those of you guys that haven't met. We've been here in this office for about 12 years now, and through that amount of time we built one of the largest natural health care clinics in the U.S. And we're probably best known for this book. It's called Cruise Ship or Nursing Home. I wrote this book last year. I always ask my patients, where do you want to end up when you're 70 or 80 years old? And what does everybody say? Cruise ship, right? The problem is where most people you know end up when they're 80, 90 years old, end up in the nursing home. So our job is to change that. And we've sold about 150,000 copies of this book, and you'll see people in here that have lost 100 pounds, gotten off of 20 medications, irreversible illnesses have gone away, And I think the reason we're able to help as many people as we are with these things is because, from what I've seen, especially recently when it comes to healthcare, is people are more sick and tired of being sick and tired. And because most people are going to the doctor, and what's generally the choice when you go to the doctor? What do they just do for you? More medication, right? And so it's getting more and more costly to be sick. Has anybody's health insurance rates gone down lately? And we've got a decrease in your rates. It gets more expensive every year. I don't even go to the doctor. My insurance rates get more expensive every year. So it's getting more expensive to be sick. But then you have this other model over here called the wellness model, whatever that means, because everybody has a different opinion on what wellness is. You know, what should you eat? How much should you exercise? Should you do paleo? Who's on Dr. Oz? So we have this multi-billion-dollar wellness industry, and we are literally sicker than we've ever been in this country. So something's not matching up there. So what we did about 5 years ago is we took a step back and said, how can we take things that actually work in these models and actually teach you to apply them? And that's when we see people really get well, and I'll go through that with you guys in a few minutes. But the first thing I want to talk about tonight is, if we all want to end up on the cruise ship, I want to talk about the 3 leading causes of death, because you got to know what you have to watch out for. All right, if you want to be well, you got to know what you're looking out for. What's everybody dying of in the United States? I mean, think about anybody that died recently that you've known what they died of.
Heart disease.
Heart disease, cancer. Yeah, those are two of the big ones. So, number 1, 2, and 3. Number 2 is actually cancer. So cancer kills about 650,000 people a year in the United States. Steve Jobs, just died of cancer. And then heart disease is the other one. And heart disease kills about 550,000 people a year in the United States. Those are the top 2. Those things kill 5 out of 6 people in our country. If you die of a disease, 5 out of 6 of you will die from those things. So that's 1, 2, 3, 4, 5, 6. Who's going to be the lucky one person out of you guys not dying of heart disease and cancer? No, you. Okay, guys. She just raised her hand first. That's optimism, which is good, but that doesn't work in the long term. So heart disease and cancer specifically, the reason so many people are dying of these things is because when I go teach people, I'll go do a lecture, and I ask people, are you healthy? If we go to Walmart and ask people, are you healthy? They're going to say yes or no based on how they what?
Yeah.
How they feel, right? Everybody bases on how you feel. The problem with basing your health on how you feel is, how does heart disease feel while it's developing in your body? You don't feel anything. How does cancer feel while it's developing in your body? You don't feel anything until it's too what? Until it's too late. I had a good friend of mine last year, 38 years old. He got diagnosed with stage 4 multiple myeloma, which is brain cancer. He was given 6 weeks to live. How do you think he felt 2 weeks before he got that diagnosis? Fine. He had no symptoms whatsoever, and that's the way it usually happens. So he felt good, but was he healthy? No, he was dying, even though he felt okay. So you can't base your health on how you feel. The only thing you can base your health on is how you function. So the better definition of health, and the only real definition of health, is 100% function. Okay, 100% function is health. And I'll go through that with you guys in a minute. Now, that's the big mistake I see people make, is they wait till they're sick to do something about the problem. And then the second biggest mistake is when they finally do something about it, they go to the doctor, and again, then it's one of these, right? So they put you on one of these, and if these don't work, what do they do then? Anybody been to the doctor recently? A different one of these, right? And if that doesn't work, then they'll do surgery. And I think everybody gets the solution to health is not more drugs and more surgery, but that's what we do in our country. And so the leading cause of death and injury in the U.S., and this is, most people don't know this. You guys know what it is? Number 1 cause of death? You heard me, did I talk about that in the workshop the other night? Leading cause of death and injury in the U.S.? It's not heart disease and it's not cancer. This was a book written by 2 PhDs and 3 MDs. It's called Death by Medicine. Have you guys seen this or seen this on the news anywhere? Death by medicine, which means what they say in here is that the leading cause of death and injury in the United States is what's called iatrogenic death. You guys ever heard of that before? Iatrogenic is Latin. It means doctor-induced death. It means you weren't supposed to die of anything. You went to the doctor. They gave you a drug or some type of intervention. That killed you, not the disease itself killed you. That's the leading cause of death and injury in the United States. So what they say in that book is that, so literally doctors, saying doctors are the leading cause of death, 780,000 people a year die from incorrectly or correctly prescribed medications or infections in the hospital, which is more people than heart disease or cancer. So if you want to avoid heart disease and cancer, that's great, but what should you be avoiding even more than that? Going to the doctor. I'm dead serious about that. I'm not anti-doctor, because we have doctors in medicine for a reason. Like if if I break my femur and I'm squirting blood, I don't want a chiropractic adjustment. I want you to take me to the emergency room and let them do their thing. But when it comes to actually being well, how many of these drugs do you think are for emergency, medications, life-saving medications? None of them. So these are drugs that these people have been on the rest of their life, had they continued to do what they were doing before. And the best way I can illustrate this is let's say you come in, you have a blood pressure like 140 over 90 or something. And I say, okay, just take this medication the rest of your life, you'll be fine. Is he going to be better or worse off than he was before I put him on the medication? What do you guys say? Why would you say worse? Most people would say better. I agree, I think it's worse too. Why would you say that? Huh?
Didn't fix anything.
Yeah, it didn't fix anything, right? So it got rid of the symptom, but if I get rid of the drug, what happens? The symptom just comes right back. It didn't fix the problem. It just stuck a piece of duct tape over the oil in your car. It didn't fix anything. And then now you have all the side effects, and this is the real issue, is that now you think you're what? Now you think you're healthy, right? So all we've done is just medicate you on your way to the nursing home. We haven't fixed anything. So our job in here is actually, instead of looking at the symptom, our job is to look at the cause of the problem. Does that make sense? I don't care what the symptom is. I want to know why you have high blood pressure. I want to know why you have back pain. I want to know why you're having problems with your menstrual cycle or your migraines. I want to know why you're having those issues. So when we look at the nervous system, we're looking at the one thing that controls every bit of health and healing in your body. So what part of your body tells everything else what to do? Your brain. Your brain and your spinal cord control everything that happens in your body. So for your heart to beat, for your colon to digest your food, information has to go from your brain down your spinal cord, out the body through those nerves. And the thing to understand about this, guys, is the more you understand about the human body, is it's literally a self-healing machine. That's all it does. So your body all day, 99% of the energy went to healing you. Just fixing imbalances. That's literally all it does every day. Cutting out bad DNA, replacing it with good DNA. Getting rid of the bad cells, replacing it with good cells. So every 30 seconds you get a new, you get 50,000 new cells. You get a new lung lining every 24 hours. You get a new stomach lining every 12 hours. So think about this. Like if you cut yourself shaving, I remember your class here than I do. If you cut yourself shaving, what do? What most people do? Put a piece of toilet paper, right? Somebody told me Band-Aid the other day. I'm like, you're way classier than me. So put a Band-Aid or a piece of toilet paper on your face. What happened if I take that off? What happens 2 hours later? What happened to the cut on my face? It healed, right? Yeah, it was a scab, so it healed up. I didn't have to think about it, pray about it, go to the doctor for it. It's self-healing by design. No doctor in the world can do that for my face except the doctor inside of me. That's the only thing that's going to heal that. So if you have that power inside of your body, have you ever thought about why can't it fix your headaches, your back pain, your stomach problems, or whatever brought you in here? And the answer is it can. Something is interfering with your body's ability to heal. And the easiest way I can interfere with your body's ability to heal is by damaging your spine. You guys remember Christopher Reeve, right? Falls off the horse. That top bone gets jammed into the brainstem, and what did that shut down? You guys remember? Hey, a lot of people say arms and legs, but it wasn't his arms and his legs, it was everything. It was his heart, his lungs, his stomach, everything got shut down. So if I gave him a really good nutrition plan, was he going to get better? No. If I gave him a good detox program, he wasn't getting better because we damaged what? His spinal cord. So the most important thing that we look at, the thing that controls every bit of that health and healing, is the brain and the spinal cord. And looking at you from the front, there's two things we have to see. From the front, you have to be straight up and down. This one doesn't do it that well anymore. But when I look at you from the front, you have to be straight. There should be no curves. From the side, though, you have to have curves. So you have to have a 45-degree curve in your neck, 45 in the mid-back, and then 45 down here in the low back. As long as you have those normal curves, all the messages get where they're supposed to go. What we see, though, is what's called subluxation, and that's through slips and falls and poor posture and old accidents and things like that. Your spine can get shifted out of position, or you can lose those normal curves. And when you do that, you literally choke off these nerves right here. Wherever the misalignment is, those nerves now get pinched. So if I opened you up and I took pliers and pinched the nerves going to your heart, when would you like me to stop doing that?
Immediately.
Like immediately, right? Because if I don't, what's going to happen to your heart? Your heart's going to stop working, you're going to die. What if I give you medication? You're going to die faster. What if you go get acupuncture? It's not going to fix it because it's direct pressure on the nerves. So the thing I want you guys to understand, this is not my opinion. This isn't like, this isn't some philosophy. This is anatomy and physiology. If I cut the nerve to your heart stops and you die. It's really simple. So when I look at your spine, by far the most important thing that we're going to see there is what we call this lateral cervical curve. So this first x-ray you're going to see, and we took this on everybody. This is someone facing this way. This is the jaw. This is the back of the head. And someone facing this way. They're not looking up. You're not looking down. You're looking straight forward. You guys see the curve there in the neck? Everybody see that? That's a 45-degree curve. That's called the arc of life, because every bit of health and healing has to come through that part of your brainstem to get down to the rest of your body. Anybody? I have small kids. If you take a banana that's curved and you straighten out a banana, what's going to happen to the banana inside? It gets broken, right? I have a 6-year-old that can't seem to peel a banana, but he does that really well. So he straightens the banana gets damaged inside. The same exact thing happens when your spinal cord, if you lose the normal curvature in the spine, it literally chokes off the spinal cord in there. And again, from the second that happens, you're now building disease and dysfunction in whatever those nerves are attached to. So this is a cross section, so that's the neck, and then that's the cross section, so that's the brain, and then that's the spinal cord, that big white cord. This is a cross section here through the neck like this. So imagine if I like cut this way and you're looking down through the top of the spinal canal. Does that make sense? This is that cross section here. You see how open and nice and open that spinal cord is? Can you guys see that? It's like a hose. All the water can get through the hose. That's a cross section through that neck. This is a cross section through this neck right here. You see now that person's lost the curve in their neck. What's it look like happened to the spinal cord? Can you guys see that okay? What does it look like happened on the one on the right? It's smashed. You guys see that? So it's like someone took a hose and kinked it like this. So if the person on the left gets the flu and the person on the right gets the flu, who's going to heal faster? The person on the left. Who gets heart disease first? The person on the right. Wait, you're telling me that my neck problem is going to cause heart disease? Yeah. Me and the Journal of American Medical Association a couple of years ago, they did a study. And you know guys who shrink as they get older, start doing this? They say if you shrink up to an inch, it increases your risk of dying of a heart attack by 68%. Biggest risk factor they know of is people who shrink. And you shrink because of damage to the spine when people start doing this, when you lose those normal curvatures. So this x-ray right here is the one thing that's controlling every bit of health and healing in your body. You have to have that curve. If you lose the curvature in the spine, it sets up what's called spinal degeneration. So you lose the curve, and that can happen from, again, a whiplash, or a lot more common, it's like sitting on computers all day long. You know, people do this all day long. And you lose that curve. This is what's called phase 1 degeneration. So the spinal cord is now stretched. There's what's called pathological tension on the spinal cord. And the spinal cord is demyelinating or degenerating. So the spinal cord literally starts to unravel. The myelin covering starts to degenerate. So if this person's sick and those organs are shutting down, that's 0 to 10 years worth of damage. And you'll be able to tell where you are because you can see there's still space in between those bones. So these discs in here are still intact. If you leave that alone any longer, what's called the Wolff's Law sets in. And Wolff's Law is where the spine actually starts to lay down calcium. You guys have heard of like bone spurs in your neck or like degenerative disc disease. That happens because you lose the disc space, and now all the pressure that used to be on the joints where it was supposed to be, all the pressure goes onto the discs. And that's when the discs start to break down. People always wonder why they have disc problem. That happens because you've lost the normal alignment there. And when you see this type of issue here, now the discs are breaking down, you're getting these bone spurs in there. That's what's called phase 2 degeneration. And if you're getting bone spurs in your neck and then the hard bones, what do you think is happening to the nerves in there? Those things are toast, guys. If you see bone spurs on your x-ray, that is a huge emergency because that's something that's been going on for 15 or 20 years. And if you leave that alone any longer, that turns into phase 3. You guys see that spinal cord? See how withered the cord is on that one on the left or on the one on the right? There's one reason I don't see very many phase 3s, and it's because those people are not walking around. Those people are literally either died from cancer or they're on 35 medications. So if you're in phase 1 or phase 2, this is something that's still correctable. Phase 3 is something that's tragic because that never should happen. There's not one person in here that should ever have a phase 3 degenerated spine. That's just through neglect or not knowing about it. So that x-ray that you're looking at right there, that's an 80-year-old woman with a perfect curve in her neck. No disc degeneration, everything's functioning normally, 0 medication, still plays golf 3 times a week. This top bone is the other thing though. So there's the curve, and then there's this top bone right here called your atlas, and that has to be pointed up at 30 degrees rather than pointed down. If you even lose 1 or 2 degrees, you're getting pressure on the brainstem, which is the most sensitive part of your body. Your brainstem is where your body makes serotonin. What do you guys think of when I say serotonin? Anybody, does that ring a bell for anybody? Yeah, sleep and depression. Those are the 2 things, sleep and mood. So if this thing gets tilted down like that and you get pressure on the brainstem, serotonin levels drop, you're not sleeping normally. I see a lot of people, anxiety, depression, and those types of things, just specifically because of that. And then the last thing you have to see is the head needs to be right up on top of the shoulders, instead of out here like this. Who do we see this posture in? Yeah, that's the nursing home posture. And what are those people always hooked up to after a while? They're on oxygen, because when your head goes forward like this, you're literally decreasing by about 30% your lung capacity when your head goes forward like this. And then when you decrease your lung capacity, what do you feel? You're tired all the time. And people think, well, I'm just fatigued, or that's just normal. It's not normal. The other thing that happens when your head goes forward, it decreases the amount of input that goes into your brain, and it decreases your pain threshold. So now everything hurts. You know, joints hurt all over the place, back hurts, elbows hurt, shoulders hurt, because the brain's not getting fed normally anymore. So those are the 3 things you got to see. You guys remember those? So 45-degree curve here, 30-degree atlas angle, and the head has to be right up on top of the shoulders. Does that make sense? All right. So that's an 80-year-old. This is a 39-year-old. What do you see on the one on the right, first of all? Curve or no curve? You guys see that? See how straight she is? So she's almost completely straight. So the spinal cord's running through here. Remember what that's doing to the spinal cord? So that's choking off the spinal cord. And what do you think that would be affecting in her body? We're damaging here. What's it going to affect? Hey, Christopher Reeve. Everything else below there. Everything in her whole body. So when she came in here, first thing she's got is this top bone, instead of being straight up like this at 30, is down at 15. So she got 16 degrees of pressure on the brainstem right here. That's what we just talked about, serotonin. So she sleeps about 3 hours a night. She's miserable. I mean, I can't imagine sleeping 3 hours a night, but that's what she's been doing for years. So what did the doctor put her on? Ambien, right? That didn't work. They put her on Lunesta. She's still not sleeping normally, but now she's drugged to where she'll at least fall asleep. You know, she's sleeping through her alarm clock all the time. The middle part of her spinal cord right through here, those are the nerves right here that go down into your arms. So she's got numbness and tingling in her hands. And the other thing she's got from here with those nerves in here, those nerves also go, same nerves that go to the hands and the nerves that go to the heart. So she's got this heart arrhythmia. And so when she exercises, her heart freaks out. And it's been doing this since she's like 25 years old. So they can't figure out what's wrong with her heart. Every time they do a stress test, they can't find it, but she's still having these issues with her heart. So right there, that damage right in there, you can see how these bones are straight, and then that one dips, and then that one really dips. Can you guys see that okay? That's phase 2 degeneration. Okay, so that's 10 to 15 years worth of damage through there. They told her she had carpal tunnel, so they did the carpal tunnel surgery, and that didn't fix it. So they flipped it over and did the other carpal tunnel. That didn't fix it, because the problem was coming from her neck. It was never coming from her hand. And I told her, I said, hey, I'm more worried about your heart than I am even about your hand, because it's the same exact nerves there. And this is what's crazy. I remember looking at her x-ray, and I asked her what she's been doing. Guess where she's been going for the last 15 years before she came here? That blew my mind when I saw this. To a chiropractor. She's been getting adjusted for 15 years before she came in here. I'm like, so you went to see the chiropractor like once? She's like, no, I went for 15 years. And I'm like, what did your x-ray look like 15 years ago? Guess what she said? Never had them. I'm like, so how the heck did the chiropractor know what they were doing? I would get popped here. I'd get popped twice in the middle of my back, both sides of my neck. You know, they put an electrodes on me, and then I was out of there. And then come back and see me when your back hurts again. There's two types of chiropractors. There's what's called relief care and corrective care. What we do is corrective care. What 95% of my profession does is what's called relief care. Nice guys, a lot of them. You know, I actually know the guy that she was going to see. Super nice guy, terrible chiropractor. Because she went to him for 15 years and her neck got nothing but what? Worse. Over 15 years. It didn't look like this 15 years ago. It got worse while she was getting adjusted. And so what we do in here is called corrective care, which means taking something like this and correcting it. So, you know, raise your hand if you want me to get rid of your migraines but leave your spinal cord rotting and degenerating. Nobody ever says yes to that, but that's what they've been doing at other chiropractors. So she came in here and we started working with her. And the reason she was going to that doc is because he was on the HMO. So he was like an HMO doctor. And I have an HMO. I would never choose my chiropractor off that list. I have an HMO in case I have some type of emergency, like my daughter, needs stitches or something like that. That's what those insurances are for. But when it comes to insurance, the reason I'm not on any of those HMOs is because who's responsible for you being well, you or your insurance? You are, right? And here's why, so you guys understand where I'm coming from with this. The reason I'm not on those HMOs is because you have to bill what's called medically necessary care. You ever heard of that before? So anything that you go to the doctor for and the doctor bills your insurance and the insurance reimburses the doctor has to be what's called medically necessary care. You ever heard that term before? Mm-hmm. Here's the definition of medically necessary. This is from the Medicare guideline. It says that this is the definition, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. I'm going to say that one more time. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. That's the exact opposite of our mission statement. So what's insurance for? What do they pay for? They pay for drugs and surgery. They pay for crisis. That's what they have it for. Your insurance doesn't pay to keep you well. It's like if you have Medicare, let's say you have Medicare and you come in here and you're pre-diabetic, you're about to have diabetes, and I can teach you for $100 how to eat the right way and never get diabetes. And how much will Medicare pay of that bill? $0, right? But how much will they pay once you get the diabetes? They'll pay $50,000 for all your testing and all your insulin and everything for the rest of your life. It's a completely crazy, stupid system. But what I always tell people is if you want to be healthy, who's responsible? You are. And who's financially responsible? Everybody hates this part. You're financially responsible. I'm financially responsible when it comes to my family. So since we're not on the HMO, I'm actually able to do the right amount of care with her. So the first thing that we did was we adjusted her, and then we did the head-weighted x-ray. And we did this on several of you guys. This is her x-ray 1 day later. So that's day 1, that's day 2. What do you see on that one on the right now? You guys see that already? Yeah, she's already got the curve coming back. So that's 15 years of the wrong type of care. That's 1 day of the right type of care. So the way we correct the spine is a lot like braces for your teeth. Anybody have braces in here? Any braces, people? So how long does it take to fix your teeth? Oh, you have braces. How long is it going to take?
Well, it was supposed to end last year.
I hear that a lot.
So
Yeah.
3 years.
Yeah, so 3 years. So a year to 3 years, depending on how long your teeth have been that way or how crooked they are, right? Thankfully, this doesn't take 3 years, but it's been that way for 15 years. So it takes about 6 months to 9 months to correct something like this. And it's very similar. Braces are, you make a correction and you leave it over time, and then you correct it, you leave it over time. It's very similar to what we're doing with your spine. So it's very specific adjustments and then very specific rehab at home that you're doing. So we adjusted her for the first 90 days. We took another x-ray after 3 months. Already things are moving back in the right direction. At that point, she's sleeping 4 or 5 hours a night. She's not on the Ambien anymore. She starts to feel her fingers again. Take an x-ray at 6 months. Again, things are moving back in the right direction. And this is her x-ray after 9 months. So what do you see on that one now? Do you guys see that? Curve. So spinal cord is no longer degenerating, no longer killing her heart there. The heart arrhythmia that she had is completely gone. Hasn't had one arrhythmia in the last 9 months since she started getting adjusted. Has no problem sleeping, is off of the medication that she was on. Her sinuses are cleared up. She had horrible sinus problems where they wanted to do like the rotor-rooter thing and, like rotor-rooter sinus out, completely gone. How long do you think she wants to keep it looking that way? Yeah, now here's the point. I want to make sure you guys get this from the beginning. This is not a treatment, it's a lifestyle. And I want to make sure you understand it's not a treatment. Treatment is what got you here. All right, treatment of disease is what got you here. This is a lifestyle. So if you go to the gym and you work out, you get really fit in a year, you just go, I'm good for the rest of my life. I'm great. No, you maintain the fitness that you have. So she comes to see me a couple times a month to maintain things. And somebody asked me the other day, like, why should people maintain their spine the rest of their life? And I'm like, well, unless you go lay on the beach in Mexico for the rest of your life, you probably wouldn't need to get adjusted that often. But I see you guys, bending over computers and doing all of those things every day. It's just something. So what she's doing is some spinal hygiene exercises to maintain that correction. It's really simple. She's not always running back in here with her back hurting again. She's doing some really simple exercises to make sure things are corrected there. Let me show you another x-ray because we took this one on you guys as well. This low back x-ray on several of you. The one from the front, your spine has to be straight up and down. So I showed you that. This is from here to here. Your spine has to be straight like this. This is the right hip, this is the left hip. That's where the spine has to be, is along this line. You see how his is? See where the dotted line is? See how those are crooked like that? Anybody know what that's called, where you're curved to the side? It's called scoliosis. Scoliosis, what that does is damages the nerves this way. So these nerves right here are being pinched. Those nerves are the ones that go down in your leg. You ever heard of like sciatica? You get pain down in the leg. So he's got sciatic pain because of the subluxation right here. So these nerves are being choked off. And what do they want to do for him? They want to do back surgery. The guy's 32 years old. They want to already do back surgery, which is insane because this back surgery is going to fix that. Not going to do anything about the curve. All they're going to go in there is cut some bone away. So he came in here and I looked at his intake form. He's on like this many, like 4 lines of medications, and I didn't know what they were, so I looked them up. And they're chemotherapy drugs because the same nerves that were right here that are going to the colon were being choked off. So what kind of problems do you think you have if you have damaged nerves going to the colon? Yeah, he had constipation really bad, and that turned into colon cancer. So now he's got diagnosed with colon cancer. And so he came in here, one of our patients referred him in, and we started working with him and adjusting him. Same kind of thing, so very specific rehab, very specific adjustments, and x-ray at 3 months, getting better. This is his x-ray after 6 months, so again, what do you see there now? Straight up and down, no more scoliosis. And the scoliosis is gone, the sciatic pain went away in about 4 visits. The guy had no more pain in his leg. The coolest thing about it is he went back to the doctor about 2 months after he started care and said, we can't find any traces of colon cancer. Somebody asked me the other night and said, do you mean that the adjustment, you healed his cancer? I want to make sure I answer that correctly. No, I didn't heal his cancer. What healed his cancer? His body did. Okay? And did the adjustment allow that to happen? You better believe it did. All right, but his body is what healed it. And the reason, like when I see that x-ray, the reason that freaks me out is when do you think that thing started in him? It didn't start when you're 32. It started when you're little. This is you see a lot of kids running around here getting adjusted. That's a 2-year-old I take care of, 20 months old. You guys see that already? See that scoliosis already? She's 2 years old. She was a vacuum extraction. They put the thing on her head and they stuck her out of the birth canal. And so right away, that took this top area of her spine, torqued it like this. Those nerves are the ones going directly to the ears. So what does she have a ton of? Ear infections. And now they want to do tubes in the ears. And they've spent thousands of dollars, on the diagnosis and the different things that she's been doing. And they brought her in here because she has a spine, not because she has ear infections. You know, and I have a daughter, so this is close to home for me. If you have a daughter, when would you like to find out that she has scoliosis? When she's 2 and it's easily correctable, or when she's 21 and they want to do a $200,000 surgery? You want to find out when it's easily correctable. So that's the reason we check kids. And the coolest thing about this little girl, her name's Katie, we adjusted her for 2 months, and kids heal so much faster. She didn't have to go home and do rehab or anything like that. Just adjustments, removing that interference, and this is 2 months later, straight up and down. Mom said she got her daughter back for the first time since she was born. Doesn't feel like a zombie anymore. She's 0 ear infections since she started. I just had a mom come in here today. I adjusted her little girl, and she called me back about 2 hours later and said this is the first time that she's like eating and not screaming and crying. 2 hours after an adjustment. You know, she got sent down by one of our patients that works down at Sprouts. That's the reason though that we check kids right there. It's because of that. And you'll see a lot of the kiddos in here. All right, last X-ray, and then we'll go back and look at yours. I won't give you the whole 9 yards here, but I just want you to get used to looking at them. So again, what do you see there on that one? Curve or no curve? No curve. See how straight she is? Where's this top bone? Should be up like this. See how hers is down like that? And her head is shifted forward 25 millimeters. She's a nurse, so she's lifting patients all day. And her name's Melanie. She came in to see me. This is a long time ago, but I met her at church, at her church. I did a talk, and she came up to me afterwards. She's got these glasses on. She's like, I need to come see you. I said, what's going on? She said, I've had a migraine for 40 days. And I'm like, so you've had like a few migraines over 40 days? She's like, no, I've had 40 days of a migraine. And when she comes in, she has this medical file like this thick, and she sticks it on my desk. I'm like, is this like your whole life story? She's like, no, this is the last 40 days. Because she works at Rose Medical Center, so she's done all the testing in the world. So they had done CAT scans, MRI, CT scan, you know, everything else in the world, but they never did what? They never took an X-ray. There wasn't one X-ray in that whole file. So it was a $50 X-ray is what found her problem. Because why is she having the migraines? What's happening to her spinal cord right there? You guys see that? See how choked off her spinal cord is? So she came in here and we started working on her and adjusting her. And this was awesome. I remember I started adjusting her, and she came back in the next day without glasses. The migraine was like a 10. Now it was like a 7. You know, and about 2 days later, the migraine was completely gone. Hasn't had a migraine since we started. And this is her X-ray after 6 months. So you guys see the change there? Death on X-ray, life on X-ray. Because the thing to understand, it's not just a migraine headache while she was being healthy through her life. That was killing her. And the coolest thing about this, though, she told me they'd been trying to get pregnant for like 4 years, and they couldn't. So she had, you know, multiple miscarriages and just could never get past about 8 weeks. And over here, this is a 6-month X-ray. We never got to her 9-month X-ray because she was pregnant after 6 months. And what happened with her, I asked her, she didn't tell me this when she came in, but she had when she was younger, she started having problems with her cycle. They were really irregular. They diagnosed her with polycystic ovarian syndrome, all kinds of issues. And so when we started adjusting her, that all got cleared out. And she has 2 kids now. I adjust her 2 kids, which is awesome. You know, the best thing that I get to see in here. And the thing I want you to understand about that was when she came in here, and it's the same thing for you guys, when you come in, you have 2 choices when you see your X-ray. You'll see it in a minute. You can fix it or let it get wet. You guys understand there's no option C. We're all mostly adults here. There's no option C. You can't just put your finger in your ears and pretend that's not happening. So it's either fix it or let it get worse. Fixing it looks like the one I just showed you. She got her life back. You know, she has 2 kids and isn't thrown up on the floor because she had migraines for 40 days anymore. This is not correcting it. Looks like this. You guys know what these are? Yeah, these are rods. So he's got 3 rods in his neck and 12 screws in his neck. So he's got a scar from here to here where they open him up, pull his trachea aside, and fuse his spine together now. How healthy do you think he is now? He's miserable. I remember the first time I met him, his name's Pete. I walked in, shook his hand. He's like, how much to cut my hands off? Excuse me. He's like, I would pay you $1 million to cut my hands off. They hurt so bad. And even if I did, it wouldn't fix anything because what's happening is all coming from his neck. So he's been addicted to OxyContin twice. You know, so this is a pastor, served God for 20 years. You know, and then now he's completely miserable. Came in here, he's on oxygen, he's on a CPAP machine at night. His whole heart and lungs are shutting down. He guy's miserable. And I asked him, I said, did you know about this problem before? Because I can't fix this now. It's spines fused together. I can't fix that. And did you know about the problem before this happened? He's like, yeah, I went to my wife's chiropractor like 5 years before this. And he took an X-ray, and he said my neck was straight. I had degeneration in the lower part of my neck. And he had a little bit of pain between his shoulders. That's the only thing he had. And the chiropractor said, if you don't get this corrected, you're either going to have neck surgery or you're going to have a heart attack and die. And Pete's a guy, so Pete said, that's not going to happen to me. right? We're really good at that. We're the best at that. That's not gonna happen to me. And here's the thing, if your neck looks like that, please don't tell me that's not gonna happen to you, because it's already what? It's already happened, yeah, it's already happened. It's there right now. And so what he told the chiropractor at that point though is, I asked him, and he's like, yeah, I didn't have the time and I didn't have the what? Money. I didn't have the time and the money. He spends 16 hours a day in a nursing home watching TV now. What does he have a lot of now? Time. And I wish to God I could help him, and I can't. I can't do anything. And he sits around all day. He would put all the time in the world in now. And he thought when he was 60 he didn't have time to correct it, but did he? Absolutely he did. My friend got diagnosed with cancer last year. Do you think it was convenient for him? To quit his job and go to Reno and fight the cancer, and so he would live as his kids would have a dad? It wasn't convenient. Disease is never convenient. It's just a matter of putting the time in and correcting it. But the second thing is I don't have the money. Which one's more expensive, by the way? Don't get me started on what your life's worth. I'm a little raw with this subject because I was watching two of my really good friends almost die of cancer last year, and they're my age. 39 years old, 37, 39 years old. And you know how much they talked about the cost of the cancer treatment? Zero times. Because you know what they cared about? They were thinking, I hope this works. That's all they cared about. Not how expensive this, but I hope this works so I can be around for my kids. And it did. They both, neither one did chemo and radiation, and they're both alive. But which one's more expensive? This was not covered by insurance, okay? So she chose to not go to her HMO chiropractor. She came here and paid out of pocket. This was covered by insurance. Which one's more expensive? Yeah, your insurance looking this way. It ain't even close, by the way. It's not even a comparison. That's a $100,000 neck surgery that they did. His life is now ruined. They had to go redo it again. The doctor got paid $30,000 the first time. When they had to redo it, guess how much he got paid that time? $30,000 again, okay? So he had to pay $10,000 out of pocket both times. So $20,000 for the surgery alone. And then he takes about $400 a month of medication. Now he lives in the nursing home. That's because his wife can't take care of him anymore. He got so bad to where his bowel and bladder stopped working, and they put him in the nursing home. Any idea how much those things cost? Have you done any research on that? It's $6,500 a month average in the United States. So he told me they've spent over the course of the 5-6 years, $400,000, not in hospital bills for the insurance, out of pocket, their cost, $400,000. That was their 401k, that was all of their retirement money, that was selling their RV that they hope to retire in, and that was to be sick. Now, Melanie, when she came in, that was over the course of 9 months. That was, 45 adjustments. That was all of her rehab, all of her x-rays. She was type 2 diabetic when she came in, so we taught her the right things, like I know you guys were at that workshop that we did the other night. So she started learning those things, started applying those things that are in the book. She's no longer type 2 diabetic, so she threw away her glucophage and her insulin. So, and that over the course of the 9 years, or over the course of the 9 months to get her spinal cord back functioning at 100%, that was about $3,000 over the course of a year. Which one's a better investment? Any financial people in here? Which one's a better investment? Yeah, it's not even close. I looked at a hospital bill today. You know how much it costs? I had a patient that went to the hospital. You know how much it cost to put the IV in? $600 to start the IV, plus the surgery. You know how much the chest X-ray took that they took? $900. I'm like, it makes me sick. I'm like, that should be $300,000, But the reason we charge what we charge is because we want to take care of families. So the bottom line is every one of you guys can afford the care that we have. Every one of you. I got single moms with 4 kids that afford our fees. It's just a matter of putting the time in to correct it. So we'll take you in the back and look at those x-rays. The only thing we ask if you're a patient here, number one is that there's 3 things. And number one is you put the time in to correct it. Does that make sense? Which means do your adjustments and do your rehab. Put the time in to correct it. Because if you don't put the time in, the problem just gets what? Worse. And how much worse does it have to get? How much more worried do you have to be about your health, and how much more health do you have to lose? You just got to put the time in. And it's time to get over the denial. Please don't tell me you're going to go home and think about it. I had a patient the other day. I'm going to go home and think about it. She wasn't going home to think about it. What was she going home to do? Forget about it. And then she comes back in here after she's had the surgery. And she didn't think about it. So it's just put the time in and correct it. Second thing that we ask is if you have family, you get them checked. We even pay for that. We pay for the exam, we pay for the x-rays. No one has to start care, but we at least ask you to get them checked. And then the last thing is that we ask is that you tell other people what you know. There are people around you right now that are sick and suffering and miserable, and they don't have to be, and they don't know any better. That mom that had the little girl, she was up, she said she's been up for 6 weeks, hasn't slept at all for 6 weeks because this little girl's screaming through the night. 4 courses of antibiotics. one adjustment, 2 hours later, the baby's asleep for the first time and eating, for the first time. So that what that mom was going through, she didn't have to go through. And you guys have the truth. You guys have it. It's something that can change somebody's life. And what does it cost you to tell somebody that truth? Nothing. It doesn't cost you anything. So we ask that you tell the people around you what you know. And so we do a thing what's called Dinner with the Doc, where we rent out a restaurant and we allow you to invite up to 6 people with you. You can bring them, and I talk for about 20 minutes about a little bit about this and what we do, and give them a chance to get checked out. If they want to, they can. If not, they get to eat dinner. But it gives you a chance to be a huge blessing to people, because you guys have no idea how many people are around you right now that have no clue that health is just right around the corner, and they're dealing with the same thing over and over again. And if you're, I always tell people, if you're offended by me asking like, hey, who are you bringing to the diabetes talk, then you probably shouldn't be a patient, because you're going to get offended a lot, because it's not about me. It's like, if my dad has diabetes and lives next to you, how much would you have to hate my dad to not say, hey, come to this class with me, So we ask you to just tell the people around you what you know, and we make that easy to do. So we're going to take you in the back now and look at those x-rays. The only thing we ask you on this x-ray is what I just said. What do you see on the spine? What's that affecting? And then really what happens if it doesn't get corrected, and are you willing to put the time in and do what it takes to correct it? Okay? So Sandy's going to come in just a second. She's going to put you guys in private rooms, and I'll be right in to go through the x-rays with you guys. Okay? All right. See you in a minute.
Sorry, I can talk to my dad and my sister-in-law.
Alex, Monica?
Although you already have had surgery, so he might not be able to help you. He was. He had surgery on his knee. No, he had surgery on his hip. Remember his disc ruptured? Oh yeah. Stop it.
How many surgeries have I had?
You're right.
So they can still fix it.
Gallbladder?
3.
Is that the thing that erupts?
Yeah.
Is yours? Or is it?
No.
What's that one that erupts and that doesn't really have a purpose? I was reading a break on your appendix. Appendix. I was reading the book one. And he was like, Dang, you look so much thinner. And he's like, yeah, I got my appendix removed. And it's a book. I don't get it. You know there's an appendix in a book?
Oh.
Oh gosh.
What's an appendix?
Did you get it? Yeah. Oh, these are T-Rexes. You go like this, and then you do like this.
I was used to a lot.
Oh, just kidding.
Tomorrow, sucking, pushing and wait. Stick your butt out. 2-second pulse. So you put your knee and your elbow to the wall and stick your butt out. Let's see you do it.
I can't.